lot has occurred in the last 8 months concerning the Black Lives Matter movement. As far as inequality goes, COVID-19 has affected all of us, but particularly those of BAME background. In reflection, what actions have been taken to reduce racial inequality in your organization?
So thank you. So I think just looking back to the COVID outbreak, we've had a number of engagement events with our BAME staff, and we've given them the opportunity to tell us what additional support might be needed. We've put in place a number of drop-in health checks and clinics, and staff have been given advice on a whole range of things that have been important to them. We've also put in additional psychological support, recognising that this has been difficult actually for all staff, but particularly for those that have been identified as higher risk in terms of the BAME population. We've also worked really hard as well to make sure we've had the risk assessments in place for our BAME staff, and we've taken everybody as an individual rather than just looking at a collective group of staff. So we've tried to make this about the person, the individual, and their needs within the context of that. Also, just sort of building on that a little bit, is that we have been focusing on the equality, diversity and inclusion portfolio, and we've just appointed a workforce inequalities lead, and that they will be working with our staff and our board to make a difference to all the lives of our BAME staff.
That's great, thank you. Obviously, we want to make sure that everything that we do is both sustainable and has a lasting impact. Therefore, in the next 6 to 12 months, what actions will you take to make even more progress?
Okay, thank you. So our organisational development team have been created some career progression workshops, specifically aimed at our BAME colleagues. And over the next 18 months, we're really going to be tracking how well they're doing and connecting through a number of mini sessions so that we can see whether that's working well for them and whether staff are progressing as we would hope that they would want to. And then we can build their specific needs, what additional support they may need within that. We've also to note that 5 of our BAME colleagues have secured places on our Stepping Up programme, and 3 additional are going through our Henley Business School for MBA programmes. And when we look at who applies for our courses, etc., we do absolutely look at who's applying and making sure that we're able to make sure we've got a diverse group of staff going through those opportunities. We've also just done a workforce equalities report to our trust board yesterday, and one of the things that's really pleasing to see is that for where people have applied for roles and they are successful going through interview, that the probability or chances of staff getting successful from that interview are exactly the same, whether from a BAME background or from any other background. So that's really good news.
That's very encouraging to hear. From a medical student's perspective, there's been a lot more awareness amongst future healthcare professionals about health equalities in the UK. As far as educating the future generation in order to reduce these discrepancies, do you have any plans or comments?
So I think going forwards, we would want to look at whether it's for medical students, for others, the things I've already spoken about, we want to make opportunities for everybody. I think in terms of specifically the medical students, I was talking to our registrars this morning, and we would want to make sure that everyone's got the opportunity to be involved in a range of work opportunities and leadership opportunities. So as you'll find out going forwards, we look for leaders both within our junior medical staff and our middle grades and our registrars, as well as our consultants, to allow them to come forward and take that opportunity to be leaders in their own right, working with colleagues, but also to make sure that they're able to contribute to the organisation as it goes forward.